everyone, my name is Micah Guidry. I am the manager here at LaBelle Cosmetic Surgery Center, and I'm also Dr. J's nurse.
Hi, I'm Dr. J. Apur Rao. I'm the surgeon here. I'm also the owner of the facility, LaBelle Center for Cosmetic Surgery. We do a lot of surgeries. One of them is facelift. We're here to talk about it today.
Just to let you all know, this is a pre-recorded webinar. However, we will be available for live chat throughout the entire thing. So if you look at the bottom right of your screen, you can see the live chat option, and please feel free to chat with us. So a very common question that we hear when ladies come in, and patients, not just ladies, men as well, for their face, what can we do? So the first thing that we like to talk about, the main procedure, would be a facelift. And Dr. J, we can do a lot of different things when it comes to a facelift. So how many different options are there?
Yeah, let's go back a little bit. Facelift is a surgical procedure. They make incisions on the face in different areas, around the ear, under the chin, over the forehead. Now, there are so many ways of doing the facelift also. Each one of them has its own reasons for it. We can combine many aspects of the procedure from different techniques. However, everybody knows us for what we call a quick lift. Quick lift is a franchise of a certain type of facelift procedure, which is less invasive than the traditional facelift, and we are known for that. However, not everybody gets a quick lift. We combine the procedures as we need along with the quick lift, including other procedures such as chin implant, cheek implant, brow lift, eyelids, and so many different ways to deal with it. Every one is different. We can combine them as the patient needs.
So if a patient comes in and says, I'm sagging here, I have lines here, I'm looking older, would that be a good candidate for a patient to have a facelift?
Very much so. This is what most patients come to us for. You know, as we grow older, the gravity works on a face, the volume of the tissues under the skin diminish and creases appear, smoking, sun damage, medical illnesses, all of that add up to this. So gravity is one of the things which is a worst enemy. But that's not the only thing. Surgery can reverse what the gravity did to you, but it cannot reverse everything.
So I think it's safe to say that facelift is not meant to be an anti-aging procedure or take 20 years off, but I think it can help you in your appearance going forward and just slightly reverse what gravity has done to help you look better moving forward.
Absolutely. Everybody thinks that you're going to take you 20 years off. No, you're going to be the same age as you've ever been. However, you're going to feel like you're much younger because you're going to look better. Everyone's going to look at you and react to you better in many different ways. And you're going to feel better because of all that. And your self-image is going to improve. And everything improves because of that. It's more or less like a brain surgery when you do a facelift. Because your brain improves. You feel so good about it.
So I think a lot of things that we also hear is a facelift an actual procedure? And I think the misconception is because there's so many non-surgical options available these days, but when we're talking about our facility and what we do at LaBelle, we do an actual facelift surgery, which does require incisions, and you do go under anesthesia for surgery.
Yes, only in this facility, we do everything in a local anesthesia and sedation to a point the patient doesn't remember anything. As far as the patient is concerned, the patient is anesthetized. As far as the doctor is concerned, the patient is sleeping deeply. There is an anesthetist taking care of the whole thing at the time. We monitor the patient just like any other patient going under full anesthesia.
How long do you think the facelift would take if you're doing just a straightforward facelift? About how many hours?
It could be anywhere between 2 to 3.5 hours maybe. But if you combine other procedures such as eyelids and brow lift, it might add up a little bit more. In any case, traditional facelifts take a lot longer than the type of facelifts we do. Every procedure we do is based upon minimalizing the amount of cutting, incision, and surgery involved and maximizing the effort with lesser surgery.
So when a patient is interested in having surgery, is there anything specific that they should do before? Because we do get that question a lot. How can I prepare? How can I better be ready for surgery?
Basically, the patient needs to be healthy. If you have any medical problems, you need to be taken care of properly, particularly diabetes and hypertension, heart condition. We do refuse many patients based upon medical illnesses. That's very important. No matter what I do, it's the body that has to heal it. So you have to be healthy to start with.
Okay, so the surgery takes about 2 to 3 hours. The patient goes home that night. They follow you up, and then as far as recovery, we hear a lot of, do I need to be in my house for a week or 5 weeks? What would you say to a patient?
Okay, recovery means different things to different people. In our facility, we have done facelifts when a patient has gone back to work in just 3 days after that. We have done facelifts when a patient stays home for a month because she does not want to show her scar to anybody for a whole month. The reality is, after the facelift, the very same day you're walking around, the very next day you're walking back into my office. And you can walk around and do your ordinary things in just a few days, as long as you can cover the incision with the hair and do some makeup to cover any kind of bruises that may be.
So facelifts can be done in many different ways. A popular franchise that we do for a facelift would be called the Quick Lift, which it is still a surgery. You still are going into the operating room and having anesthesia. But like Dr. J said, our patients generally have surgery on a Thursday, and by Monday they're back going to the office. So in terms of bruising and swelling, what would you say to a patient to be prepared for that?
It's amazing. We use what's called tumescent anesthesia on the face, which is something, which is a fluid that we inject all around the face that gives you anesthesia and also minimizes bleeding. Now, of course, it does not eliminate bleeding. It is surgery just like any other surgery. However, the technique we use minimizes those complications. Even though it does not eliminate it, about 1/3 of the patients don't even get a bruise. Those who do get it get minimal bruise, which can easily be camouflaged with makeup. Swelling is a body issue. The body takes care of the healing process. Face will be swollen, but the swelling is never really as bad to stop you from working or doing anything within just a few days. Many people go back to work in 3 or 4 days, but the actual amount of swelling that goes away in a week is about 50%, in about 3 weeks about 70%, but it takes about 3 months to go all the swelling. But in just 2 weeks, nobody will know you have a swelling. You have any swelling. It's that kind of swelling we're talking about.
So just a reminder, we are available for live chat. If you look at the lower right-hand corner of your screen, please feel free to comment, ask questions. We're here to help you. But the next thing we wanted to go over, scarring. We hear a lot about scarring. What does it look like? What happens? Do you have to shave my hair for the procedure? So let's go over that.
Again, it's amazing how people worry about scars. You know, they immediately think about keloids and big bad scars everywhere. Of course, such scars in the face will be very bad indeed. We won't be doing procedure at all if that's the case. Let me explain it. Whenever there is a cut, there's going to be a scar, period. The only thing we can do is to hide it as best as we can. That's what cosmetic surgery is all about. We put in a scar, we put in an incision a couple of millimeters behind the hairline. In such a way, the hair actually goes through the scar in about 2 or 3 months' time. The scar recedes behind the hairline after a while, and it's hardly visible. You have to go looking for it to see the scar. The scar typically starts here, goes to the edge of the ear, and goes to the back of the ear, and comes to the hairline here. All of this part is normally covered with hair. Even if you pull the hair back, after 3 months, you can hardly see the scar because it's gone behind the hairline. So there will be another scar under the chin. That'll look like a natural skin crease. So scars are very easily hidden away 99% of the time. Okay. We also have some scar treatment to make those scars thinner than ever. It takes about 6 months for the scar to finally heal, but in just 2 or 3 weeks, people have difficulty finding it.
And the sutures from that, when we suture up that hairline, do they fall out? Do we need to take them out?
Yeah, we put numerous tiny sutures. We use absorbable sutures. That means the part of the suture that's inside the body, under the skin, will get absorbed, and what's outside will fall off. Approximately 2 weeks time. So we don't have to take any stitches out. By the way, I want to let you know that many physicians feel comfortable using a drain in this procedure, which is a difficult problem for the patient to take care of. In our facility, we hardly ever use a drain. It's just a technical preferences we have, and it works out perfectly well for us. We also do not use heavy mummy-like dressings over the face. You may have a gauze the first day, next day it's out.
Okay, so after the procedure, we send the patient home. As far as pain, what is their comfort level after until we see them the next day?
Yeah, everybody worries about pain naturally. However, most of our patients basically just need some Tylenol. Believe it or not, it's hardly ever a prescribed narcotic. I will in case if necessary, but I hardly ever do. The first day particularly, I don't give any pain medicine, because if they do get a lot of pain the first day after surgery, it often indicates complications. I would like to know. I don't want to hide it with pain medicine, particularly narcotics. So if I do surgery in the morning, I'd be happy to see it within 24 hours, anytime, day or night. And I'm happy to be available with a cell phone given to you.
Another common question that we hear is what kind of risk and complications come from this procedure, and how likely are they to happen to me as a patient?
Yeah, there are lots of tiny complications, minor complications with any surgery. That's common to all surgery, such as little infection, little suture problem, little collection of blood. All of those are minor and easy to take care of, just like any surgery. But the dreaded ones are very, very rare. More common are the bad complications is a bleeding that can happen under the skin, which is probably less than 1% chance of it. And I have to be available the first 24 hours and the first week, anytime such a thing is suspected. And you have to be available for me to take care of it immediately. Because if it's not taken care of immediately, that will result in bigger complications such as skin loss. The second one is that everybody worries about is a nerve injury to the facial nerves. Now this is something that's better explained with pictures and everything in front of you, which we normally do during our consultation. The bottom line is, occasionally a nerve that is supplying the forehead muscles that control the eyebrow line, upper eyelid, can be injured. Now, traditional facelift involves a lot more dissection, and is more common with the traditional types of facelifts. The type of facelift we do is less invasive and specifically designed to minimize this complication. Even though it's not zero, it is probably 1 in 1,000 or even less. And even those who get it is very temporary.
So we get a lot of phone calls about the lifestyle lift. Can you tell us the difference between the lifestyle lift and the quick lift?
Oh yes, Lifestyle Lift has been in business for a long time, but recently went out of business. They are very similar to what we do, but not the same. Lifestyle Lift emphasizes more lifting the jawline and the neck, and Facelift, Quick Lift, emphasizes more lifting the jawline and the cheek. Now we can easily combine, which is what we usually do in our facility. Many of the patients who've been looking for Lifestyle Lift are coming to us at this time, thankfully.
Dr. J, how long have you been doing cosmetic surgery in general, not just facelifts?
I have been doing cosmetic surgery for the last 15 years and facelift approximately 13 years. We've done lots of procedures. Facelift, facial procedures comprise about half of what I do. So it's a wonderful procedure. One of the happiest patients I have are patients who come to me for facelift.
So in conclusion, we just wanted everyone to know that please feel free to call our office for your personal consultation, during which time you do meet with Dr. J personally, one-on-one, for him to go over every issue that you have, not just the face, any part that you want us to help you with. And during that time, you will get to see before and after pictures. You will get a price specific to you for each procedure, and you also get to go home with lots of information to read on each procedure that we covered, and it's all at no cost to you.